All right. Thank you so much, everyone, for joining us today for our culinary medicine session on supporting picky eaters with celiac disease. I'm Vanessa Weisbrod, the Chief of Education and Community Engagement at the Celiac Disease Foundation, and just really grateful to our amazing panelists today for joining us. This program has been a real dream come true for our team in bringing together research and medical knowledge and pairing it with nutrition and culinary education. So I really hope that you all enjoy today's session as much as we have all enjoyed putting it together for you. I want to acknowledge SHAR USA. SHAR has truly believed in this program since the very beginning and has helped us to grow it. Megan, if you could switch the slide, thank you. They have always believed in doing innovative programming to support celiac disease patients and gluten-free diet education, and we're just very grateful for their support. So today's session is going to be moderated by Sharon Weston. Sharon Weston is the dietitian at Boston Children's Hospital and has been a huge part of the culinary medicine community for quite some time. And so we're really grateful to have her here today. Before she introduces the speaker, I just want to quickly mention the continuing education credits. This session is accredited for CEUs for physicians and for dietitians. At the end of the session, or you can scan these QR codes now. We will put these up again. Health providers will need to complete the survey by Monday, September 23rd at the end of the day to get their credits. So without further ado, I will hand it over to Sharon to introduce the speakers.
Great. Thanks, Vanessa. So I'd like to introduce our speakers for today's webinar. We have Dr. Jackie Jossen, who is a pediatric gastroenterologist at Columbia Medical Center in New York. And we also have Raquela Adelsberg, who is a pediatric dietitian in the Division of Pediatric GI at Mount Sinai in New York. Thank you.
All right, so we will get started with Dr. Jossen.
Okay, let me just grab my slides here. All right, you can see them?
Yep, they look good.
Okay, excellent. All right, so I wanted to first thank Vanessa and Marilyn and the Celiac Disease Foundation for inviting me to speak today. It's a great pleasure to talk about celiac disease and picky eating. So I wanted to first kind of start by explaining that there is a very wide range of feeding difficulties. And on one side are the kind of picky or fussy or preferential eaters. And on the other side of the spectrum are patients that have more significant eating disorders, including ARFID, which I will talk about a little bit today. But I think before we can talk about the spectrum of feeding difficulties and picky eating, we have to talk about what is normal. And so we'll try to talk a little bit about what is normal versus not. I'll try to explain a little bit of the subtypes of picky eating, nutritional concerns, and then when to ask for help and who to ask. So what is normal? There's some degree of picky eating that is protective from an evolutionary perspective, right? You should have some fear of things that are foreign to you. And so for like a real life equivalent, what we see in children is after weaning and hitting 1 and 1.5 years of age, we see a little bit of natural hesitation towards eating and decreased appetite as we see that the growth curve starts to plateau a little bit and kids don't gain weight quite as quickly. Between age 2 and 5 is when we see the biggest peak in what's called food neophobia or fear of new foods. And we also see very significant variable day-to-day intake. So children who will do an amazing job eating one day and then not eat very well at all the next day. And this is considered normal, although causes parents a lot of distress. And then after age 5, but in a gradual fashion, we start to see an improvement in the amount and types of what children eat. So what is picky eating? it's really more of an umbrella term for a spectrum of different characteristics that are perceived by a caretaker or a provider to be restricted. So these can include a lack of dietary variety, extremely strong food preferences, food neophobia, or an unwillingness to eat familiar foods or try new foods. And generally, it's severe enough to interfere with the daily routine to an extent where there's a problematic relationship with the parent-child relationship, or problematic to the parent or child in general. And given the lack of a single definition for picky eating, it's really challenging to put a fixed label on what is normal picky eating. But it's been suggested that kind of a normal picky eater is someone who has very strong preferences for foods, but overall will have 20 or more foods from different nutritional categories. And we start to worry about problematic picky eating when children have less than 20 foods in their diet. So there are many subtypes of picky eating, and understanding where a child lies on this spectrum can really help in choosing how to address it. Some children go through what are called food jags. They eat one or just a few foods over and over again for days or weeks at a time, and it's often followed by complete elimination of that food from the diet. There are often challenges with reintroduction of that food later in time. If anyone's ever read this book, Bread and Jam for Francis, when I read this for the first time, I thought about food jags. This little character eats bread and jam for every meal and every snack for days. Unlike in real life, Francis, in 3 days manages to go from a food jag to eating the most beautiful, diverse diets. It's not quite realistic. Some children develop flavor fatigue. They get bored with certain foods or tastes. Even halfway through a meal, they could just say, I'm tired of this, I don't want any more. Some children have food restrictions that are because of mechanical issues, difficulty with chewing or swallowing, or they have other medical issues, including celiac disease, food allergies, type 1 diabetes, and this can contribute to the type of picky eating that they have. Still, other kids have sensory issues around food. This is very common in children with autism spectrum disorder, but is seen in all children, many types of picky eaters. And kids will eat only things of a certain consistency. They only like crunchy foods. They can get upset if the food looks a little bit different, if it's a different brand. And then lastly, food neophobia, which is probably the most common of all the picky eating subtypes. It's what I see in the office the most. It can be either from fear of a particular symptom, especially vomiting, which is termed emetophobia, or a generalized anxiety that can cause fear of new foods. And when picky eating becomes extreme, there can be an eating disorder called ARFID, which again, I'm going to touch on just briefly in a little bit. So food neophobia is the most common form of picky eating that I see, like I said, and there are several factors that have been shown to be associated with the development of food neophobia in children. And this really includes a lot of parental factors. So maternal food neophobia, fear of new foods within the mother, a lack of parental support or affection at meal times, or having a limited time to actually prepare meals can predispose to the development of food neophobia. Also, lack of exposure, similar to that, like diet with a low variety or quality. And then parental pressure, so kind of the attitude that occurs during meals, anxiety, and just children's innate preferences for sweets. So all of these have been shown in studies to contribute to the development of food neophobia in kids. And depending on the definition, because again, there's no real good definition of picky eating, their studies cite anywhere from 12 to 100% of children demonstrating neophobic behaviors. If you look at some of the more rigorous studies, it's probably between 20 and 50% that really fall into this category. And this is based mostly on a scale by Pliner and Hobden, which is quite old, actually, from 1992. And this scale is a scale that's used to assess food neophobia. I would argue that we need something a little bit better, because I think some of these questions are a little outdated, maybe for our environment, but this is what's used in a lot of the historical literature. As a doctor, I think it's also really important when we're dealing with someone with picky eating to make sure that the picky eating is just that there's no other underlying disease process that's contributing. This is especially true if there are gastrointestinal symptoms. So these are some of the causes that can contribute to picky eating. Children with EOE may experience dysphagia, which is difficulty swallowing. Occasionally there are food impactions where food actually gets stuck on the way down. And this can lead to progressive refusal of foods, specifically ones that are tougher or chewier, harder to chew and stay more intact on the way down. And this photo on the bottom of the screen is a picture of what an esophagus looks like with EOE. It's very thick and there are these kind of vertical lines that go down, and this is not what a normal esophagus should look like. There are children with dysphagia, with or without aspiration. So again, difficulties with swallowing with or without liquids or foods going into the airway. That's seen in the top photo. That arrow demonstrates some of the contrast going from the swallowing tube, the esophagus, into the airway. Constipation is actually a really common cause of picky eating, especially when it comes to decreased food volume. So kids will tend to eat a little bit less. It can be perceived as pickiness. And oftentimes after they have a nice bowel movement, their early satiety resolves and things get a little bit better. And then reflux, lactose intolerance, and inflammatory bowel disease all can lead to gastrointestinal discomfort, which serves as a negative feedback for the eating experience and can progressively lead to picky eating, but need to be addressed in and of themselves. So I wanted to touch just briefly on avoidant restrictive food intake disorder, or ARFID. This is a form of eating disorder and characterized by a reduction in food volume and or variety motivated by one or more prototypic presentations. Aversions to a specific food or group of foods is one of the presentations of ARFID. It's important to realize that if you have a bad experience with food, most people will try to avoid repeating that unpleasant experience, right? But in ARFID, that unpleasant experience may not be real. It may be something imagined, but result in the same type of avoidance as someone who had an actual experience with an aversive consequence. There can be a generalized lack of interest in eating or severe sensory sensitivity. And there is a real line between avoidant or restrictive eating and crossing into ARFID, which is a disordered eating pattern. And this really occurs when the nutritional status is impacted, okay? And very important, to distinguish between ARFID and other causes, other types of eating disorders like anorexia nervosa. In ARFID, there's no altered body image. That doesn't play a role in these children or adults' food behaviors. There is a 9-item questionnaire that has been developed for ARFID. However, there is a lot of crossover here with normal anxiety that may be associated with keeping a gluten-free diet or a restricted diet. And so care really must be taken when you are considering making this diagnosis in a child, and especially a child with celiac disease. It should be considered when the dietary restriction really extends beyond just the gluten-free diet and those normal age-appropriate feeding patterns, and when there's concern for nutritional status disruption. So again, picky eating really is not the same as ARFID, and if you have concerns that your child is more than just a picky eater, please discuss this with your doctor and dietitian so that you can have the appropriate assessment. For picky eaters, there is often a lot of concern about the nutritional implications of this limited diet. And the first focus point I really want to bring up is the perception versus the reality. Sometimes there's a mismatch between what families will perceive as picky and what would be considered truly abnormal for age, especially if there's a sibling that did not exhibit similar behaviors. Families will sometimes use that as a direct comparison, not realizing that the picky eater is still within normal range. If there's truly restricted eating, we worry about the implications of the child's nutritional status. But again, I think it's important to remember that if a child consumes like a select number of fruits and vegetables, but eats them very, very regularly, this may be sufficient, even though it's sometimes perceived as pickiness by families. Data is really mixed on how energy and vitamin intake differ between diverse and picky eaters. And so despite the admonitions of, eat your vegetables if you want to grow, there isn't great consistent data on if transient picky eating actually impacts your overall growth trajectory. But again, it's notable that the studies are really difficult to compare because there's no uniform definition for picky eating. And when assessing vitamin intake, it's important to realize that a decreased intake may still meet the recommended dietary allowance or the minimums that are recommended by age. So even though they seem to have less, it still may be enough. And vitamin supplementation can be recommended and offered if nutrition assessment suggests that the current intake does not meet those minimum requirements. So what about children with celiac disease? So children with celiac disease who follow a gluten-free diet are already starting with a diet that's higher in fat and sugar and lower in fiber and vitamin fortification. If you add picky eating, you increase the risk for nutritional concerns. And one of the biggest sources of vitamins in the American child's diet is enriched wheat flour-based cereals and breads. They're a major source of B vitamins and iron. And here's just an example. On the right, you can see these two nutrition labels, and you can see the difference in the vitamin fortification from this very popular gluten-free cereal to the one that's enriched wheat-based cereal. Food neophobia in celiac disease is compounded by the fact that we have labeling laws that are relatively confusing to understand, right? We have fear of symptoms and developing any symptoms with cross contamination. And there's overall a lack of objective data to suggest which behaviors are safe versus not. And so food neophobia progresses. A big shout out to actually Vanessa and some of her colleagues who have made some amazing strides to try to define, to do these studies to define what is truly a risky behavior and not. And the more we can do this, the more we can provide adequate education to families about what is safe and what isn't, and hopefully address some of this new food neophobia. Because in a sense, this is protective in celiac disease, but the implications of fear of outside foods or new foods need to be acknowledged, and education needs to ensure that hypervigilant behaviors do not develop, as this can really significantly impact the child's quality of life. There's very little research that's been done specifically regarding celiac disease and picky eating or food neophobia. There was one study that compared celiac patients on a gluten-free diet to non-celiac patients on a gluten-free diet, and it was not surprising to find that the food neophobia scores were significantly higher in the celiac group for the reasons I just discussed. And challenges with picky eating and celiac are compounded outside of the home. I'm sure we've all heard these comments. The food there is gross. They don't let me bring my own food, and there's nothing there. There's nothing to eat there, even when there is. It's just what the child doesn't want. So families that work hard to put 504 plans into place, it's nice to have safe food provided by the school, but then oftentimes they just hear this food is gross or I don't like it, and it provides an additional challenge. It's hard enough to feed a picky eater out of the home, and then to ensure that the food is also safe for a patient with celiac disease really requires a tremendous amount of work on the parent's part to communicate and advocate for their child. If possible, it's helpful to get involved as a parent, communicate with the schools and the camps. Dietitians and physicians can help with creative ways to work within the circumstances that the child lives in, or provide letters to help parents bring food to places that generally don't allow outside food. But these are areas where I think there's a great need for changes to help support children with celiac and picky eating. So my colleagues are going to speak in more detail about how we can prevent and improve picky eating, but it's really important. These are the top 3 things that I find. So studies have shown that these play a key role: involvement, getting kids in the kitchen, bringing them to the supermarket, and involving them in more than just the sitting at the table for a meal. We want to avoid authoritative behavior around mealtime. It creates a stressful environment. Positive attitudes amongst parents at mealtime have been shown to improve the eating habits of the child, but avoiding overly permissive behavior is also important. And then allowing good access to foods, not just the ones they want, but the ones you are encouraging them to try. Studies show that it takes many presentations of a food before it is accepted by the child. And it can be incredibly frustrating to keep offering and offering with refusal, but it's normal and you should continue to offer in order to eventually get that acceptance. If you don't offer, improvements can't occur. And then try to avoid offering the same food twice in any 2-day period. So if you have a selective eater, make a list of the foods that the child likes and eats on a regular basis, and then write out a 2 to 3 day menu where there isn't any overlap in the foods. Try to have each meal contain a starchy food, a protein, and a fruit or vegetable. And this allows for the kind of avoidance of food jags where they're eating over and over again, and at least some diversity even within the limited window. So what happens if you need more help? So there are a variety of individuals that can help parents support their picky eaters. For general picky eating, especially in celiac disease, dietitians can help assess the nutritional gaps. They can highlight kids that are at increased risk for true deficiencies and have a lot of experience and tools to help. Dr. Raquela is going to talk more about this, but one very popular technique is called food chaining, and dietitians and doctors can help with some of these examples. But you start with a child who likes French fries with ketchup, and then you can move them on to potato wedges with ketchup, and then you can move on to apple wedges, to apple slices, or you can take your potato wedges and move in the sweet potato direction. So there are a couple different ways to try to slowly encourage the child to try new foods instead of just presenting them with a piece of broccoli. Your pediatrician or a pediatric gastroenterologist is important. Again, if there's concern for other pathology, can help monitor the growth curves if there's concern about intake and nutrition. They can do blood work to conduct an objective assessment for underlying diseases, and can also discuss some medications and supplements that can help. And beyond that, for patients that really have a much more difficult picky eating time, speech and language pathologists. Again, I think it's important to know that speech and language pathologists, many of them focus on the mechanics of feeding, so children with dysphagia, but some do specialize in selective eating. So when you go to look for a speech and language pathologist, make sure you look at what their area of expertise is. Same thing with occupational therapists. Some of them do specialize in picky eating, but you're going to want to seek those out. Clinical psychologists, they can be really helpful in assessing for particular circumstances of eating behaviors. For children who are old enough, they can help with cognitive behavioral therapy, or they can help with some exposure therapy. Exposure therapy is when you gradually increase the child's contact with new foods, starting at looking, smelling, touching, and progressing up to finally eating. And so psychologists, amongst others, can help with this progression. And then for children who really need it, there are intensive feeding programs for picky eaters. There are many, many online programs and books that if you have a restricted time schedule or there isn't a good feeding therapist or psychologist in your area, you can use one of these online programs or books to give you some ideas. There's books on food chaining, etc., that can provide you some support at home. That's it for me. Thank you. Happy eating. Bon appetit.
Thank you, Jackie. All right, Raquela, you're up.
I'm just going to share my screen. Okay. Hi, everyone. My name is Raquela. Like Sharon said, I am a pediatric GI dietitian at Mount Sinai. And I am going to be speaking as to the specifics of nutritionally supporting our picky eaters with celiac disease. To start, I tend to not use the word picky, especially with patients and parents. I tend to use the word selective a little bit more. I think it has a little bit less of a negative connotation to it. And one thing I'm going to be speaking about today is the way that we speak about food to our children and try and keep things as positive or neutral as possible rather than having a word that can give a little bit of a negative connotation. So there's really three places that I view picky eating in celiac disease as coming from. There's the place where it comes from more of a gastrointestinal manifestation of celiac disease. So if a patient comes in that's symptomatic from celiac disease, things like food aversions or avoidances can come from there, especially if they have a little bit of a decreased appetite or, their stomach aches or their diarrhea or their constipation is preventing them from eating in a normal way. And then similar to what Dr. Jossen said, there can be kind of the parenting effect on food behavior. So pressuring a child to eat, or speaking negatively about food, this really can control the level of intake that a patient or a child eats, because the parent is controlling the level of intake versus responding to that child's natural hunger or satiety cues. Parents tend to use bribery as a way of getting kids to eat. We've all done it, but doing this more and more in the context of celiac disease can have more of a selective eating result. And literature and studies have shown that there is a large association between pressuring behaviors from parents or caregivers and then resulting in food fears or more selective eating. Then the third place that this can come from is more of the medical effects. A lot of our celiac patients tend to be a little bit more medicalized than, an average kid. They have endoscopies, they have appointments, maybe they have the appointments leading up to getting the celiac diagnosis that's talking a lot about growth. Maybe they see an endocrinologist. So it's already being spoken about in front of the child a lot, whether it's their eating behaviors or their lack of growth or just figuring out something that's wrong and trying to get help. So that leads to, a lot more speak about food and a lot more talk about, one more bite, eat a little bit more so that you can grow. Sometimes kids are put on prior elimination diets, so that already increases the selective eating chances in these children. And then the last thing is oral nutrition supplements, things like Pediasure, where they're given with good intentions to help the child grow and develop, but it fills them up and then they have less likelihood of trying new things or being interested in what's being served at home. Now, along with any growth concerns, so thinking about calories, along with that comes micronutrients. And there are a lot of nutrients that are impacted by selective eating. I think pretty much all of them can be impacted by selective eating, but some of the big ones are iron, vitamin D, calcium, a lot of the B vitamins, zinc, fiber for sure. But these also overlap a lot with the particular nutrients that we emphasize that kind of need to be replenished or thought about a little bit more with a transition into a gluten-free diet. So iron is a big one. A lot of our patients tend to be iron deficient because of the celiac. B vitamins, which are usually many of them fortified, as Dr. Jossen said, in some of our breads and our wheat breads and our wheat-based breakfast cereals. And then fiber, of course, is in many gluten-containing whole grains. So some of the nutrient deficiencies we see, like I said, are iron, B vitamins, especially B12 and fiber. Fortunately, a lot of these vitamins all kind of come from very similar places. So beef has both iron and B12. Things like beans and legumes tend to have actually iron, B vitamins, and fiber. Fortified gluten-free grains or fortified or enriched gluten-free breakfast cereals have some of these. Nutritional yeast is a good one that's gaining increased popularity just around the world. So paying attention to these specific vitamins and knowing these are the foods to prioritize a little bit more can sometimes help parents know when you're dealing with a more selective eater, what are the foods we should be promoting and what are the foods that we don't need to be, as encouraging with. In terms of avoiding deficiencies, like we said, whole grain gluten-free products are always going to be what has the most fiber and the most nutrition. Whole grain corn, sorghum, whole grain rice, or brown rice. enriched gluten-free products. There's not as many, like Dr. Johnson said, as the wheat-based, but I have a few examples here. Gluten-free Chex are pretty fortified. If you've seen any of the made good bars, these morning ones are fortified with vitamins and minerals. And then foods that aren't processed, just alternative plant foods, things like quinoa, which we have pictured here. And then just focusing on non-grain sources of nutrition that are whole foods. So dairy, lean animal proteins, legumes, things like beans and lentils and nuts and seeds. Those are all nutritional powerhouses and are really, really good ways to get your children to eat more well-balanced without having to focus as much on packaged and processed foods. To touch on micronutrient supplementations, I will say I get asked a lot about this, and I definitely recommend a regular general gluten-free multivitamin, especially while patients are transitioning from a gluten-containing diet to a gluten-free diet, while they're still kind of finding their preferences and some of their gluten-free alternatives. It is nice to have the reassurance that your child is on a multivitamin. It's definitely not a substitute for a well-balanced diet, although the one vitamin that is better absorbed from supplements rather than food is folic acid, which is one of those B vitamins. So you're really looking for supplements that have vitamin C, zinc, a B complex, or a combination of B vitamins. Many do not contain iron. So if the patient is iron deficient, sometimes we recommend a separate iron supplement. I tend to use this Renzo's one that I like because it's just vitamin C. It doesn't taste weird. It's a melty tab. These are just some that we use. But as long as the multivitamin is gluten-free and has some of those basic vitamins that I mentioned before, then you're in good shape. And that allows parents to take a little bit of the pressure off in their feeding behaviors because they know that they're kind of covered with micronutrients for a little while. Now, some common missteps with celiac patients that can lead to more selective eating, or for patients that already are selective eaters. One is unrealistic expectations. So, expecting you to presenting a new food at the dinner table and expecting that your child is just going to eat it, even though it's brand new, or, even presenting something 3, 4, or 5 times and expecting your child to immediately eat it is an unrealistic expectations in a more selective eater. Coming up, I do have some strategies, things like food chaining that Dr. Johnson spoke about. Another is overcompensating. So with patients that do have to be gluten-free, sometimes parents will say, I feel so bad that they can't have X, so I give them Y. Or, I feel so bad that they can't eat anything at the birthday party, so I took them for ice cream beforehand. Just more overcompensating behaviors that at the beginning feel like it's something you need to do to keep your child happy, but ends up kind of burning you, on the other side of things, because then they come to expect that, or it increases the selective eating behaviors. Hypervigilance is another big one that we see, which sometimes can take a non-selective eater and make them become more of a selective eater because it increases that food neophobia. So not eating out at restaurants or nitpicking what the child is picking out. So making sure that obviously we're keeping our children safe from a celiac perspective, but not being too hypervigilant so that it increases those food neophobic behaviors. Another misstep, and we see this mostly at the beginning of a celiac diagnosis. So initially when we're transitioning to a full gluten-free diet is saying, you can have this donut just this time. Your celiac diagnosis is still new. We're going to give you cake on just your birthday, meaning gluten-containing cake. And so that's kind of the opposite of hypervigilance, which is confusing for children. So we try and avoid doing that, of course. And in general, the biggest misstep I would say that I see is a tendency to introduce more snack foods, packaged and processed foods into the children's diet when we transition to a gluten-free diet. So for example, it could be a child that had eggs for breakfast, fruit for a snack, and spaghetti and meat sauce, let's say, for dinner. But because there's so many fun new gluten-free products on the market, the parents will introduce a gluten-free waffle for breakfast and gluten-free chicken nuggets for dinner. And then, maybe a new gluten-free Oreo for a snack. So you took a kid who was eating a regular protein for breakfast and replacing that with a processed food. You're taking the snack, which was fruit, and again, replacing that with a packaged food, and same thing for dinner. So we try and, keep the diet as regular as possible, especially if the child was eating a lot of whole, real foods, and try and not introduce more snack foods than they were already getting. And then next, I have about 7 tips for feeding a picky eater with celiac disease. So this is kind of the crux of some tips and tricks and things to do to help feed your picky eater. The first is, especially when you already have a selective eater, I think it's good. Maybe it's after today, or maybe it's next week, for you to say to yourself, we are going to start a new chapter in regards to meeting and mealtime and feeding. It's very important to speak positively around food, not to say your kid is a picky eater in front of them, and to be very optimistic with the whole feeding process. If you do get discouraged, definitely do it in the privacy of your own room or the bathroom. If you need a minute to take a breath, because it is incredibly frustrating, you can do that, but really trying not to do it in front of the children, not trying to do it during appointments when you're with your pediatric gastroenterologist and say, so-and-so is so picky, it's impossible to feed them, not talking to other parents about it in front of them. It's also important to set a good example. So at meal times, showing them that you have a well-balanced plate, that you're not afraid of foods, which can sometimes be a little bit difficult if the parents are a little bit food neophobic. So it's really important to kind of say to yourself, we're kind of starting fresh, and this is, we're going to have a more positive outlook on how to handle feeding. Second is to echo what I was just saying a few minutes ago, which is focusing on the real food that your child ate before. So you can make a list of the proteins, the animal proteins, the plant-based protein sources, legumes, things like beans and chickpeas, dairy, fruits, vegetables. Focus on everything that your child was eating beforehand, whether it's before the celiac diagnosis or even a few months ago before you started seeing an increase in the selective eating behaviors. And similar to what Dr. Johnson was saying, is you can kind of list these out and incorporate these into meals and snacks, making sure not to repeat them too often. For example, yesterday I was speaking to a patient who was really excited that their child started to eat avocado. So then it was avocado in their smoothie in the morning, and then it was avocado with their lunch, and then it was avocado with their dinner. So trying not to do too much of one food to prevent food jags and so that they don't get sick of it. But it's important to incorporate all of these real foods into their meals and snacks. Having it all down on a piece of paper in front of you or on your computer in front of you can sometimes help you meal plan in a little bit more of an organized fashion. Third tip is to have structured meals at approximately the same time so that there's not as much snacking. We see a lot of snacking for some reason in our celiac patients because, I think parents tend to be a little bit more lenient, especially if they had prior growth issues or they had, prior decreased appetite. So I really emphasize having a structured breakfast, lunch, and dinner, maybe 1 or 2 snacks during the day at the most. And this also prevents the reliance on packaged and processed foods. It allows them to sit and listen to their hunger and satiety cues. This is a big one, allowing food exploration. Very, very important to allow kids to interact with foods. The number 1 tip I have on feeding a picky eater is the goal should not be immediately that they eat the food. The goal should be that they're interacting with the food. You can talk to them about the food that they're eating, identifying the foods that they like, whether they're specific colors. Maybe your kid doesn't like green foods, but you can talk about all the orange foods that your child likes, or even all the beige food your child likes. You could talk about the taste, the textures, and kind of finding the common denominators. Just talking about it in a very neutral, positive way can help. Encouraging your child to try things is fine, but definitely not forcing, not offering bribes. it's important to make sure that you're doing this, again, very neutrally, so that your child doesn't feel pressure. If you are trying a new food or a new meal, you can try it as an appetizer sometimes with everybody together, and everyone that way is trying it. Alternatively, you could also make rating cards. I love this idea. It works with so many of my patients. The child obviously has to be able to write and understand, so maybe above the age of 4, but make little cards for a new, I have some examples coming up for a new food, especially when you're transitioning to a gluten-free diet with your celiac child. Having everyone try the alternatives, maybe speaking to your older children that don't have to be on a gluten-free diet about it and that they need to be positive about it. But this can be fun sometimes. You could do a different pasta, every Monday, and everyone can try the different pastas that they like, and that can kind of be how you find a favorite new pasta. And then also giving credit for helping in the kitchen, smelling the food, touching the food, licking the food. Those those in and of themselves are huge accomplishments. So it's important to be able to recognize that for your child, that sometimes even interacting with it is a big deal, and that's a precursor for them actually eating the food. This is the little things I was talking about. They're blurry because these rating cards are downloadable from Etsy. You can make your own. You could download them from Etsy. You can make them on Canva or on a PowerPoint or on a Word document, but these are really fun to do, and you could do it specifically for what you're introducing and make little scorecards. You can make prizes for, whoever gave it the highest score, gets a new toy or blanket or stuffed animal or something fun. The fifth tip is to incorporate gluten-free substitutes in ways that are familiar. I think this goes without saying, is that the gluten-free substitutes are not always exactly similar to the food that the child was used to eating beforehand. So if we introduce it in a way that is familiar, it increases the likelihood that the child will eat it. For example, if your child loves frozen chicken nuggets, making a chicken nugget from scratch with gluten-free panko is not always going to be the most similar. It's going to be different in taste. It's going to be different in texture than what they're used to eating. So introducing it that way is not always going to be met with the most success. So then we rely more on food chaining or bridging. So a few examples are like that frozen chicken nugget that I gave you. You're going to want to try and look for a frozen gluten-free chicken nugget in a similar shape first. And then you could kind of move on to maybe the homemade gluten-free chicken nugget and make it in a similar shape if you can. You can use cookie cutters and things like that. And then from there, maybe your child will accept any homemade gluten-free chicken nugget in any shape. Another example I have here is spaghetti. So if your child only ate one shape of regular gluten-containing penne and only ate it with ketchup, moving on to gluten-free penne with ketchup and not all of a sudden going straight to gluten-free spaghetti and meat sauce. The way that you would do this is then once your child accepts the gluten-free penne, you would move on to gluten-free spaghetti and ketchup. From there, move on to gluten-free spaghetti with ketchup and a little bit of marinara sauce. From there, the gluten-free spaghetti with marinara. From there, the gluten-free spaghetti with marinara and a tiny bit of ground beef. And from there, moving on to gluten-free spaghetti with meat sauce. I tend to go a little bit slower for celiac patients because the textures do change even in that first step from penne and ketchup to gluten-free penne and ketchup. So I tend to go a little bit slower with food chaining, and sometimes that is a misstep that parents move a little bit too fast through the food chaining. For my sixth tip, presenting new food options in small amounts is really, really essential. Sometimes we tend to load up a plate. If a new food, for example, quinoa is something that you're trying to introduce in your home, I would not put more than, a teaspoon on your child's plate. They just have to tolerate it on their plate. Do not give up after the first few times of it sitting there. If they are at least tolerating it on their plate, that, like I said, in and of itself is an accomplishment. If they touch it, if they lick it, if they smell it, that's a huge accomplishment too. Definitely try new foods together as a family, as I said before, and it's definitely important to serve it with a safe food. So even if you're sick of your child only eating gluten-free pasta, I would still put it on the plate with the quinoa because you want to make sure that they still have something to eat and that they feel safe. And it's really, really important. Like I said, don't give up after the first few times. Studies show that it can take up to 20, 30, or even 40 exposures to a food before eating it. This is something from Feeding Littles. If you don't know who they are, they're an account on social media, but they also have courses on their website for feeding toddlers. And they had this cute infographic where, the first million times that you present broccoli, the child doesn't eat it. But by the time they're so used to seeing it and interacting with it, eventually they will come to eat it a lot of the time. And my last tip is to get your child in the kitchen, have your child go grocery shopping with you, have your child pick out foods that they want to be eating, maybe that they saw someone else eating. Really take the lead from your child, definitely have them get in the kitchen with you, help you cook or help you bake, or even just watching you do things. They don't even have to touch it at the beginning, can be really helpful. And that's where I'm going to leave you. And Vanessa is going to do our culinary portion, and this kind of leads into what she's going to do.
Thanks, Raquella, and thanks, Jackie, as well, for both of your amazing presentations. So I'm going to talk just a little bit now about the fun side of things and the cooking, the touching, and the really experiencing of the food. So these are, just to start, I'm very quickly going to go through some of my favorite ways to engage myself with food, my friends with food, my family with food, and my kids with food. So like Raquella mentioned, there are lots of ways that we can engage with food. You can take a cooking class. You can subscribe to food magazines. I love getting food magazines. It gives me so much inspiration. I've gone to culinary school and I still am inspired every time I get another food magazine in my mailbox. There are millions, maybe trillions of cooking videos online. And so even if you pick one ingredient that you or your child like and just go to YouTube and look up apple cooking videos, you will find millions of videos that you can watch. But I think most importantly, it's important to remember to be realistic, that if we start out after today's webinar and try and include a million new things into our routine, you're probably not going to be successful with it. And so it's important to start slow and to have realistic goals. So some things that I have tried with my own kids, and these are pictures of my kids and their friends, and things that have really worked. So starting out when you're cooking, plate with purpose. That photo you see on top is of a taco salad. If I were to serve my kids a taco salad that way, they would absolutely not eat it. But if you plate all of the ingredients separately on the counter and let them make their own plates and their own bowls, they're more likely to try the ingredients on their own than all tossed together. So you can try this with lots of things, and we're actually going to do this in the cooking video in just a second. Getting kids in the kitchen is such an important thing, but it's important that you don't just put them in the kitchen with the tools that you as an adult use. You want to find tools that are safe for them and allow them to safely and participate in a way that they can feel confident. Other things that I like to do with my kids, hang out in the cookbook aisle of a bookstore. There are thousands of cookbooks in every bookstore. Let them go, let them find one that inspires them. And my rule with my kids is that if they want to buy one of the books, they have to agree that every week we're going to cook a different recipe from it, which works out really well. I think a lot of times we can be afraid of the mess, that if we let our kids in the kitchen, it's going to be a total disaster and take us forever to clean up. The best thing that you can do is just accept that messes happen, but that kitchens are built to be easily cleaned and to be able to wipe them down. And so try and just take a deep breath, accept there'll be a mess, and don't worry about it, because your kids being willing to interact with food and make that mess means that they're engaging with the food. And like Raquella said, take them to the grocery store. I take my kids to the store all the time. And again, the rule we have is that if they put it in the cart, they have to agree to at least taste it. They don't have to love it, but they have to at least taste it. And finally, food is beautiful, and it is beautiful to watch it grow. So go to a local orchard, let them pick their own fruit, buy seeds, plant a garden in your backyard and watch it grow. It is so fun to watch your garden go from a seed to having, gigantic zucchini and cucumbers and tomatoes. And it's a great way for the kids to get excited about the food. And then finally, food can be art. It can be really beautiful. If you can see in this last photo here on the right, I'll often put down just a large piece of butcher paper over the table or counter with crayons and let the kids sit around the food if we're having a dinner party and color around it and actually decorate what would be a tablecloth. It's a really fun way to encourage them to sit around the food, but also to make art out of it. So with that, we will jump into today's cooking demo. Welcome to the kitchen, everyone. I hope you've learned some great tips for inspiring kids or adults in the kitchen. Today, we are going to make one of my all-time favorite recipes. It was initiated by my grandma. We called her Mama, but then handed down to my mom, who we now call Mimi. And so today we are making a take on Mimi's famous chicken noodle soup. We have lots of fantastic ingredients to go into the soup. It's fall. We're starting to get into when we want to come home and have a hearty soup for dinner. But sometimes kids or some adults don't like it when there are too many veggies all in their bowl. And so today we're going to talk about how we can help inspire ourselves to eat more vegetables and how we can work up to maybe not liking them at all to incorporating them into what we're going to eat. Today's cooking demo would be ridiculous if we didn't include kids in it. Come on in, kiddos. So I have 4 fabulous helpers with me today. What do you think about chicken noodle soup?
I love it. Disgusting. Best.
We have lots of awesome fresh ingredients here. We have carrots and celery, garlic, some chopped up ginger, tomatoes, white onion, butternut squash.
Chicken.
Oh yeah, of course we have lots of chicken. And these noodles, they are hard, and these noodles are kind of exciting. Do you know what kind of noodles they are?
Ramen.
Ramen is something that I really missed when I found out I had celiac disease. And it's really awesome that now there are companies that make a brown rice ramen. So these noodles are made out of brown rice. And so we're going to use those in our soup today. We then have some garlic salt and some Italian seasoning. So guys, would you eat a bowl of soup if we took, if in your bowl you saw just big pieces of carrots and celery and squash?
No.
We have some kids here who would dive right in and are eating the raw vegetables, and others who are a little bit more hesitant on eating the veggies. So one way that we can help encourage kids to eat vegetables is by trying to disguise them a little bit. And so one way we're going to do that today is by making them smaller. We're going to do that in the food processors. We're going to dump our carrots into the top here. We have all the safety mechanisms on. Okay, so go ahead and take this and push it down. What's through the celery?
Me.
Okay, come on over.
I will. This one is gonna be cool.
Okay, ready?
Oh yeah.
Gavin, you want to do the onions?
Sure.
Do the garlic. Go ahead and take this out because we want to separate out these vegetables from the squash because we're going to add them in at different times. We're going to do the butternut squash. Again, we're doing this separately because we're going to add it into the soup at a different time point. So we have our veggies that were all chopped up together here. Ready, Leo, to do the butternut squash?
Yep. Oh, that's a lot.
I know. The other really awesome thing about using your food processor is that you saved your hands having to chop up all of these vegetables. The food processor does it in a matter of seconds, where this would probably take you maybe 20 minutes even to chop all of these vegetables up to get ready to make your soup. So it's a really big time saver. Normally, if I was making this soup all together, I would cook the noodles towards the very end once all of the other ingredients had fused together with the chicken broth. But because we're doing this deconstructed today so the kids can assemble it themselves, we're actually going to cook the noodles first. So we're going to put these ramen noodles into the boiling water. They need to cook for 4 minutes. So we're just going to let them go ahead and cook, and we'll be back as soon as they are ready to go. Our noodles are soft and they're all ready to go. So I'm just going to drain them out of our pot here. And we're going to set them aside until the kids are ready to put them into their soup. Now we're ready to make all the different parts of the soup. So we're going to start with our pot, with some olive oil. We're going to let the olive oil get warm. And as soon as the olive oil is warm, we're going to add in our veggies. The reason that I separated out our celery, garlic, onions, and carrots is because these are your traditional mirepoix, or your traditional vegetables that we use for seasoning and cooking. And so they're very common flavors that are more easily liked by more people. The second stage of this, I'm going to do the butternut squash, the tomatoes, and the ginger, so that when the kids assemble their bowls, they can pick and choose. They might not want all of them together, but maybe they'll try one or the other. So it gives some options. If I was doing it for myself, I would put them all together because I love all of these flavors all together. So we're going to add in our veggies to the pot. We're going to let these simmer until they are nice and soft and maybe even a little golden. You can see that our veggies are all nice and soft and slightly starting to caramelize, which the flavors are going to be just absolutely amazing. They smell just delicious. So we're going to go ahead and set those aside. So I'm going to scoop them out of the pot so that we can cook our butternut squash, tomatoes, and ginger. I'm not going to wash the pan or anything in between because we actually do want to keep all these flavors in. And if I wash the pan every time, we'll lose the flavors that are attached to the bottom of the pan. So we're just going to add a teeny bit more olive oil. I also haven't seasoned any of the vegetables yet. We're going to season the broth so that that holds all of the flavor and we keep all the vegetables very bland until we mix everything together. So we'll put in the butternut squash, our tomatoes. These are just chopped tomatoes and about a teaspoon of minced ginger. And again, just like with our veggies, we're gonna let this batch of veggies cook for about 3 to 4 minutes. The squash and tomatoes and ginger is ready to go. So we're gonna go ahead and take this off and put it into a bowl. The recipe that you're going to download for today's class actually has included cooking the chicken. Just for time's sake for today, I went ahead and pre-roasted the chicken and shredded it, but this is absolutely something that you could do right at the very beginning of making the soup. But just to keep things moving quickly today, we did that ahead of time. On the stove now, we have our chicken broth that I seasoned with salt and some garlic salt, as well as some Italian seasoning. So this is just nice and boiling here. So it's going to sit and simmer for just another minute or so while the kids assemble their bowls. So can I have my kids back in the kitchen, please?
Yes, sir.
All right, so each kid is going to take a bowl and they're going to come here and they're going to assemble their bowls with the items that they want in them.
First, I put in a lot of noodles, like a lot. Then I put some chicken, and then I put a lot of this stuff, and I mix it up with this stuff.
Good job. Okay, so we got some of everything in that bowl.
I took all of the noodles, 13 pieces of chicken, and I added the tiniest bit of this.
Okay.
I started off with some noodles. To add a little variety, I added some more noodles. And to top it off, you gotta add the noodles.
Okay, so we have 3 very different bowls of soup here, but now we're going to finish all of the soup off with the delicious broth on top.
And so myself.
And now we're going to put it all together how I would want to eat it. And that's how Mimi would make her chicken noodle soup. I hope you enjoyed today's recipe and learned some tips for how to inspire your kids or other adult picky eaters in your house to enjoy a really delicious meal.
Well, thank you, everybody. That was amazing. So, and I love the input from the boys. That was very helpful to see. So, so we're going to just quickly go through some of the questions in the chat and the Q&A. And I think the first question that we have is, what happens when a child won't move through the food chaining and instead stops at the beginning? And maybe Dr. Johnson. Yeah.
Yeah, I can start to answer. So I think, remember, there are different tools and techniques out there, and not every technique is going to work for each kid. So I think in this circumstance, there, are two things. The first one, again, is offer, offer, offer. If it's not there and presented, it can never be accepted. And then this is a situation where you may want to start with more of that kind of exposure therapy. So if you have those like gluten-free penne and they still are like not interested in moving on to the gluten-free spaghetti, like in Raquel's example, they can start by looking at it, they can start by touching it, smelling it, licking it, and then they can get gradually more comfortable with, that second step before even just making the jump in the food chain to that next food.
Great. I have a question for Raquel. So Raquel, how do you balance picky eaters with busy caregiver lives who have limited eating out options? Are there any suggestions for healthy meal prep for busy parents?
Yeah, I do think that, we're in a totally different day and age than probably when, I grew up, where parents are really busy. But, I do think one of the most important things to allowing your child to have more options is by cooking at home. So choosing really one day of the week to be kind of, a time where you can make 3 or 4 things to help carry you through the week can be really, really helpful. Some people prefer to do it on Sundays. Some people actually do prefer to do it on Fridays so that they have food for the weekend and they don't need to be eating as much out on the weekend. And like I said, preparing 1 or 2 safe foods is really important for your child. And then preparing 1 or 2 new foods or foods that are somewhat new to continue to expose them to. I would choose different things each weekend. Let's say you do it on Friday. Broccoli, like we're going to talk about, as kind of the quintessential picky eating food that kids don't love to eat. I wouldn't have it broccoli on weekend 1, broccoli on weekend 2, broccoli on weekend 3. I'd really try and change it up. But also allowing your child to go to restaurants as part of, being on a gluten-free diet is still important so that we get away from some of that, hypervigilance. But allowing them to look at the menu and read the menu and see things that they would potentially be interested in eating, I think is really helpful. So it doesn't necessarily be that you can never go to restaurants, but I think a balance is important.
Great. All right. And then we're going to take just one more question, and then we're going to just send out a recap of the questions and answers with the recording. But there was a question that came up for children with celiac and type 1 diabetes. What are some gluten-free or low-carb breakfast ideas? We try to eat low-carb before school to avoid high blood sugars. We struggle trying to find gluten-free or low-carb breakfast options for our picky eater.
Yeah, so there are lots of different options, and I posted some of these in the Q&A, but some of my favorite things for kids with celiac and type 1 diabetes are things like egg muffins that can be made with just eggs or cheese and different types of vegetables, or any, veggies that you can encourage your kids to eat. I also love making gluten-free waffles using almond flour. Almond flour is one of those ingredients that is really great for a dual diagnosis because it's packed with protein and fiber. And so it's something that you can actually use for your baked goods that works for both diets.
Great. Well, thank you to all of our speakers for presenting on this very important and challenging topic today. And we will have this all recapped in our recording.